Our final recipient is something new this year. This is we've added a Lifetime Achievement Award, which our board created specifically to honor our first recipient, Mike Tomsyck, VP of Finance and Treasurer for Kolbe Windows Doors. Mike, please come on up. So for the past 29 years, Mike has been a stalwart supporter and advocate for employer-driven healthcare reform. It was 1993 when Mike began talking with other employers in the Wausau market about the concerns he had about rising healthcare costs and also the lack of transparency of cost and quality information. And those early conversations led to 6 employers deciding to form a coalition, the Northcentral Employers Healthcare Alliance, or NEHA. Over the next 25 years, NEHA would provide a vehicle for employers to realize their goals of establishing their own provider network, owning and controlling their own data, and having a forum to learn with and from each other about healthcare best practices. Mike was at the table for much of that work, eventually becoming the board chair. And Mike became a student of healthcare reimbursement. It's incredible what he knows. He reviewed the terms and signed off on the contracts. And as NEHA grew in size, they also expanded their service offerings to group purchase of PBMs, disease management, dental services, and even establishing multi-employer near-site primary care clinics. In 2021, it was Mike's initiative that led NEHA to combine forces with the Alliance. And we welcomed many employers from the Wausau market. You saw Diana's slide welcoming the new employers from this last fiscal year. We were delighted to have NEHA members among them. I have had the privilege to know Mike for at least 2 decades, and it is remarkable and rare to have an employer in the C-suite, no less, maintain this level of volunteer involvement. There is no one I know who is more committed to the vision of employer-driven healthcare than he is, and no one more dedicated to doing the right thing for employers and employees in the Wausau region. Mike, congratulations. It's our honor to give you this Lifetime Achievement Award.
Well, my first thought when Cheryl said that they're going to give me an award and it was a lifetime achievement, I says, does that mean that I'm old? And then I realized that I really started this whole thing when I was 15, so I guess it wasn't so bad after all. But seriously, I'd like to thank the Alliance for this award. Those who know me know that I get pretty passionate about healthcare. I pick on providers a lot, but again, it's our money that's being spent, and it's always important to watch that money. But I would be remiss if I didn't say that healthcare in North Central Wisconsin would be vastly different if a group of people decided that we would just maintain the status quo in the early 90s. When we got together, we realized very quickly, and when we were asking questions, that we needed data to make good decisions. And ultimately, we realized that we needed to own the contracts because that would give us the direct link to the providers that we really sought. Now, at the time, that was pretty scary, jump out of your comfort zone, but in our hearts, we knew that it was the right thing to do. Fortunately, we've had some good managers of our coalition over the years to guide us on our journey. And I can say I've been absolutely blessed to work with many, many of the NEHA member companies over the years. And really, I'd like to dedicate this award to those member companies that shared the NEHA vision. Working together, we showed that we could change healthcare in North Central Wisconsin. And we talk about change. There certainly has been a lot of changes in healthcare in the last 30 years. Just think in the last 5 years, there's a lot of changes, and they're not necessarily good for the employer. We see provider consolidation, so it makes it really tough to negotiate good contracts. You got the big 4 insurers that promise employers the world with their networks, but really, you know that they're just really looking out after their Medicare Advantage and their fully insured business and to give the employer the short shift. I think there's been attempts really to kind of mute the voice of the employer, and that isn't good for anybody here, because I always say, we're the ones paying the bulk of the bills. You got to listen to us. We're the ones holding the money. And that's why it's so important to band together and fight the good fight, just as Will Walker said. We need more employers to share the vision. So now, as your newest board member, I'm going to say the same thing I always said to NEHA members. Everyone is on the membership committee. Tell the story. Push the brokers that you know to get other people to join the alliance. Just think of the impact we could have, especially when next year when Diana says we're at 500 members. Thank you very much.